Welcome back, everybody. This is Cameron Dennis. I'm a physical therapist at Back on Track Physical Therapy in Shawnee, Ohio. So, welcome, everybody. Today, I wanted to talk about 5 things you need to know about back pain. And I'm just going to kind of go down the list and list off and kind of explain what I mean by each thing. And you may be surprised to hear some of these. So, let's get right into it. So, back pain is the most common medical complaint in the United States, with up to 80% of people in the United States reporting back pain at some point in their lives. What that means is that you're in good company. You may not feel like it, but so many people have low back pain. And many times the pain is short term, like if you pull a muscle or something like that. Um, And even most severe back pain will resolve itself within 1 year, um, especially if you receive some form of treatment. And that can include, and we'll go into the details on some of these, but that can include um, physical therapy, chiropractic, massage therapy, steroid injections, or oral steroids, or surgery, different things, right? And every person's going to need something different. Every person is different, and so we'll talk about that though. But yes, it's extremely important that you understand it's very common. So even though you might feel like you're alone, and even though you might feel like, this is the worst thing that'll ever happen to you, because I know in some cases with severe sciatic pain, it can be debilitating and can really affect people mentally and emotionally. Um, because you take a person who is very active and all of a sudden now they can hardly get out of bed, right? So, but there's a lot that you can do. There's a lot of hope. So let's talk about it. Um, we'll get into that more in number 5. But number 2, in terms of 2 out of the 5 things you need to know about back pain, the second thing is an MRI is not necessarily a great way to determine the cause of your back pain in and of itself. And what that means is that it can be helpful and seeing what's going on. However, a picture is still just a picture. It doesn't necessarily describe what's physiologically going on in your body. It doesn't describe the processes. You can't see what's going on with movement necessarily unless you have some form of functional MRI, which most people do not do. This is just a typical MRI that most people will get, um, when you think of an MRI. So, why is an MRI not that helpful? What the situation is, is that it lacks context. Um, so context is everything with low back pain. Now, of course, your doctor may be able to put that context into perspective, in terms of correlating what's going on with your MRI, or what they can see on the MRI correlating with, um, what your symptoms are. However, it's not always a good way, because what you can find is that a lot of people who have back pain actually have completely normal MRIs, or that they might have issues, but it doesn't correlate with their symptoms very well. Um, for example, you might have someone with sciatic nerve pain, going down their leg, like you may hear about. But then you look at the MRI and you can't really see any major disc herniations. You can't see any issues in the spine, or the spacing within the spinal canal or anything. And so you may, if you didn't know better, you may think that, hey, like they might be making it up, right? Because if the MRI is clear, well, why are they having pain? Well, it's because the image is not a good indicator. It's not a good way to diagnose back pain, the specific cause of the back pain. Um, and so what we need to know are, what are the symptoms? When did it start? What makes it better and worse? Um, we need the context. We need all of the information, because that will give us a clear pathway many times, or at least tell us where to start in terms of the rehabilitation of this injury, of this person with this injury. So basically what I'm getting at is, if you get an MRI for your back, and it comes back either really bad or with nothing at all, nothing wrong at all, um, either one of those can be problematic in someone's mind. You know, if they have really bad back pain and it comes back that there's nothing wrong on the MRI, they may be very frustrated. And we've seen that a lot. They may be very frustrated because they're seeing, they're having all these symptoms, but they feel that if there's nothing on the MRI, that there's nothing that can be done to fix it, and that's absolutely not true. On the other side of that, some MRIs are very, you can see a lot of different things. You can see arthritis, disc degeneration, or what we call degenerative disc disease. You've probably heard of that if you've had back pain. Um, and so you might have these things on the MRI picture, but the patient has no symptoms. So, what's the situation here? Um, the difference is the situation is that structure does not equal function. So the structure that you can see in a picture does not necessarily indicate how someone is functioning. This is something that I think modern medicine is struggling to come to terms with because what you find is that you'll have surgeons recommending low back surgeries like fusions, spinal fusions for patients with disc herniations that may not necessarily need it because that may not have been causing their pain. They may have had the disc herniation, but that doesn't necessarily mean that's causing the problem. And so we have a lot of people getting unnecessary spinal fusions and unnecessary back surgeries that are then getting infected, that are then, potentially needing longer hospital stays, leading to complications. And more commonly, I would say, would be the back surgeries that are, or the patients requiring back surgeries, getting these back surgeries, um, and then having additional back surgeries years down the road because it didn't actually fix the problem or it caused additional problems. Um, and so I realize there are other surgeries that are not fusions, spinal fusions, but every surgery does have inherent risks and you can't undo a surgery completely. So the best thing to do is to get as much conservative treatment as you can. So physical therapy would be my uh, top recommendation for anyone who's having back pain. Um, so we'll go into more details about that, but specifically regarding the MRI, get different perspectives on your pain. A surgeon will have a different outlook than a physical therapist. So, number three on the out of the things you need to know about back pain is that disc herniations do not necessarily require surgery, and most do not. I'm going to say that one more time. Disc herniations do not necessarily require surgery, and most do not require surgery. Only about 10% of back surgeries or of back pain require surgery. So do not buy into the narrative that you must have surgery. Most disc herniations and most what you might hear is blown out discs, and you might hear of bulging discs and all of these different things that sound really intense and they sound like, your back's totally destroyed, but you must not buy into the narrative that it requires surgery. 90% of back injuries will heal themselves with conservative treatment. Um, because like I said, back surgery, once you have back surgery, there's no going back. And most back surgeons or most doctors will tell you that back surgeries it's like flipping a coin, whether it'll help or not. And there's a good chance that it could either have no effect or could make it worse. And so to me, that should be the last resort. The very last resort would be back surgery after you've tried everything. You've tried therapy at three different places, to two all the way through to discharge, not that you try a couple sessions and then you give up and then you go somewhere else, right? Go all the way through. If that doesn't take care of it completely, first it should have made it should have helped to some extent, right? If it doesn't, try a different place, try injections, try all the things before you do surgery, okay? That's the biggest thing, by the way, is my biggest thing that if you learn nothing from this episode, it's that I want you to learn that back surgery is not necessarily a good um, fix for your back pain unless you have some really severe issue where you're wheelchair bound or you can not get out of bed, severe back pain. Um, so number four, correct posture is not a great way to prevent back or neck pain. Um, this is one that I think people are still really confused about because you still hear physical therapists and chiropractors talking about posture. However, if you look at the actual research, it does not show, studies do not show a good direct correlation between bad posture and back pain or neck pain. And also, they do not show a correlation between good posture, quote unquote, good posture, and lack of back or neck pain. And the situation behind that is, I think a lot of back pain and neck pain comes from being in the same position for a long period of time, um, rather than um, moving about during the day and trying to be in different positions. And so if you're sitting a lot at work, try to stand up periodically throughout the day. Try to move your head left and right. Um, try to move your shoulders around, things like that. Try to change what you're doing. Your body loves and craves movement and variety of movement. And so there is no correct posture. That's something that humans made up. It really is, truly is. There are people with what you would see as being atrocious posture, um, that have no issues. There are people that maintain what you might consider to be a perfect posture that have issues. And test this out for yourself, okay? Think about this. Try to go through one whole day at work and have what you might consider perfect posture. By the end of the day, you're still going to be sore because those muscles that you've been using for the entire day are going to be tired, right? I mean, even if you do this for weeks at a time to allow for those muscles to adapt and things like that, I think you're still going to have soreness because you're still stressing the same muscles and structures for a long period of time. And so what you need to do is just mix it up. Okay. And that goes for if you're standing a lot, if you're sitting a lot throughout the day, mix it up. Okay. So there is no correct posture. You can quote me on that. Okay. So last but not least, number five, the fix for most back pain is conservative treatment. Get a thorough assessment. Um, Here at Back on Track Physical Therapy in Shawnee, we're looking at a lot of different things, okay? We're looking at the entire person. We sit down and we meet with you one-on-one. We're going to do an assessment. We're going to figure out what caused this to start. What's the onset look like? Was it gradual? Was it sudden? Was there an event that caused it? What's the intensity like? Is it getting better? Is it getting worse? Is it high intensity during certain times of the day? The specific presentation of symptoms. So is it just painful on one side or both? Does it go into the buttock or the hips? Do you have burning in the feet or the legs? Do you have numbness or tingling going down the back of one or both legs? All of these things tell us something about what's going on inside your body. And more importantly, they tell us what the pathway to recovery is going to look like. Um, so can it be centralized? So can certain movements like bending forward or bending backwards or standing or sitting, can those help any radiating pain that's going down the legs? Can those help that pain to just go away completely? Or even, say it was going down to the calf, maybe now in this position, it's only going up, going down to the butt. So there's a lot of different things. What does your daily activity look like? Those things can be changed to encourage recovery or at least prevent further worsening of your symptoms. Um, what daily activities are affected and what types of things are you looking to get back to? We'll talk to you about how your symptoms are affecting your day to day mental aspect, right? So, like I said earlier in the podcast, a lot of times people have depression with chronic pain. They have anxiety about their injury. They feel that, they may never get better and maybe no one understands, what they're going through. So we talk to people, we listen, and that's the most important part is that we listen. We're trying to get information from you. We're trying to make you allow you to feel heard for the first time, maybe, um, since this happened. Um, so the treatment will look different for everyone, but in general, here's what it's going to look like. Okay. You have your evaluation where we do the listening, we do the assessment, figure out what makes it better, what makes it worse. We go into those things we just talked about, in terms of the onset and your presentation. We create a plan. Your plan will look something like this initially, right? It's calm things down first, so allow you to get back to your regular everyday activities, right? A lot of rehab places will stop there, and that's the problem. You don't want to just stop at the calming stuff down phase. Once people return to their daily activities, that's good, but what is allowing them to return to their higher level activities, picking up their kids, jumping up and down, running, climbing hills, hiking, uh, exercise, lifting heavy boxes overhead, things like that. Those are things that get skipped at a lot of other physical therapy places that are, they're doing their best. They might just be working in a system that doesn't allow them to do these things. And I've heard it time and time again. It's very frustrating, but and that's actually why I started this company is so that we could go through and do these things and make sure people are getting taken as far as they'd like to go. Because this truly, it truly should be about you and your goals as opposed to just what your insurance company wants to do or what the facilities, management will allow you to do. So avoiding aggravating factors is step one. Step two, the feel good treatments. So the massage, the sometimes manipulation, gentle manipulation or mobilization of those spinal segments, or sometimes of the hips. So feel good things. Sometimes dry needling can be effective. It's going to be different for everyone, but the next thing, and sometimes we'll do these, it's not like day one we'll do this, day two we'll do this. They all kind of flow together. Okay. Introduce low pain movements and isometrics. So what we would do is find the movements that feel good for you and have you do those throughout the day. Um, Now, these movements are going to help to, one, allow the muscles to move a little bit more loose, to feel a little bit more loose, but to allow you to move more freely throughout the day, because you're not afraid to move, right? You feel comfortable moving, and so your body will allow you to move. When you're stiff and you're stuck in the same position, a lot of times your body is fearful, you're fearful, so muscles will tighten up, the nervous system will become um, tense, it will become hyper excitable, and so things that shouldn't cause you pain will cause you pain. But you can reduce that sensitivity by encouraging normal everyday movements that feel good, or at least don't feel bad. They don't make your symptoms worse. Isometrics are a way for us. If you look it up on Google or YouTube, you'll see some examples of these. But basically, it's a way for us to start to apply gentle loads to the muscles and the ligaments, the tendons, the bones um, of the hips, of the back to start to facilitate that recovery. Because once we can start to load those structures, we can gradually increase, right? So the next phase is to increase loads of the affected areas so that you can slowly start to return to more challenging daily activities. Um, so progressively returning to normal daily activities is the next step, right? So, maybe one day you're not able to get up the stairs, but over the course of time, maybe you're able to go up the stairs. Maybe day one, you could only go up one step at a time. Day three, you can go up, left foot on step one, right foot on step two, left foot on step three. So like step over step. And then eventually, maybe you could be able to even carry things up the stairs, right? These are all things we'll practice in rehab, in therapy. And then preventative measures is step 6. So once you've returned to all of your normal daily activities and all the things you want to do, such as, the weightlifting, the carrying your grandkids, your kids, um, running, jumping, whatever it is you want to do, get up off the ground. Sometimes it's just, people just want to get up off the ground or be able to go up and down stairs or be able to get up off of one knee. Once you're able to do all of those things, our goal is to get you into an independent program where you're able to do it on your own, something that you can do for basically indefinitely. And it doesn't necessarily have to look like just physical therapy exercises, but what it'll look like is a program that will help you to be able to do the things that you want to do in your life. So whether that's picking up your kids or grandkids or all those things I listed, it's going to be specific to the activities that matter to you. Those are the types of things we'll want you to do throughout the week. It's not that you'll have to do everything every day or 5 times a day. Maybe we'll have you do these twice a week, but you'll be on your own doing these things. Um, and you'll be able to return if you have any questions. You could call, but you could return if things changed and you wanted an updated program. So anyway, the idea is there's a process behind all of this. Okay, so I know everyone wants the quick fix, but the quick fix is not the fix you think it is. Back surgery is not the fix you think it is. I've seen it enough times to know how many people regret having back surgeries. So don't make that mistake. Try conservative treatment. It really is effective. It just takes time and effort. And I know that can be challenging for people, but it really can work and will work in 90% of people. So hang in there. But these are the 5 things that I wanted everyone to know about back pain. Okay. If you have any questions at all, please call our office at 567-356-4385. We can get you set up with an evaluation. We'll do a verification of your insurance benefits so you know what it should look like to come in as far as financial costs. But being a private company, we do work with you as much as we possibly can in terms of monthly payment plans and things. We try not to allow money to be the thing that keeps you from getting better. So, um, once again, this is Cameron Dennis. I'm a physical therapist out here at Back on Track Therapy in Shawnee, Lima area. And hopefully this helps. Please let us know if you have any questions. You can also send me email at cameron@backontracktherapy.com. And we should be having another 1 to 2. I have 2 guests that are going to be coming on, hopefully within the next couple of weeks here. Scheduling can be tricky um, since I have a 7-year-old and a 6-month-old. And yeah, so anyway, thank you for listening and hope to talk to you soon. Thank you. Bye.